So, how does a patient of ovarian malignancy come to us? A lady usually comes with an adnexal mass. Adnexal mass, right? So, whenever we get someone with adnexal mass, we do imaging. We do imaging, and we do tumor markers, age-appropriate tumor markers, and based on that, if the tumor markers are elevated and imaging is suggestive of malignancy, we proceed accordingly. So what are the imaging, what are the types of imaging, what are the criteria of imaging that predicts malignancy? There are many. One is IOTA classification, which is absolutely image based. Then there are RMI, risk of malignancy indicator, and ROMA. So these scores incorporate age, image characteristics, and tumor markers. Different score takes different tumor markers, and some take absolute number of age, some take the postmenopausal, premenopausal, perimenopausal status. So these are the indicators, and when there is a high suspicion of malignancy, we plan further treatment. So for treating someone with malignancy, we need to obtain tissue diagnosis. So we can do two things. One is we can do a primary surgery. Where we operate and do a surgical staging. So after surgery, we know what is the stage and what is the exact histopathology, and then treat accordingly. Or we can do a true cut biopsy from the mass, and we can do PET CT or detail other imagings for spread of the disease, especially if the disease is widespread. We identify what type of malignancy it is and then give chemotherapy. Chemotherapy, when it is given prior to surgery, is known as neoadjuvant chemotherapy. So we give neoadjuvant chemotherapy, then assess response, and then do surgery. Sometimes after surgery also chemo is needed, and that is known as adjuvant chemotherapy. Right, so treatment of ovarian cancer is basically a combination of surgery and chemo in a order which is most suitable to the patient. The tissue diagnosis is either by microinvasive tissue harvest like true cut biopsy and histopathology, or direct surgical tissue harvesting by doing a complete staging surgery. So let us discuss what are the treatment options in a case of ovarian cancer. So there is something known as staging laparotomy. Where we have a tumor, we have a high suspicion from RMI or ROMA that this can be malignant, but we are not sure. So we go ahead, remove the mass, remove uterus with cervix, remove bilateral adnexa, the tubes and ovaries, para-aortic plus pelvic lymph node dissection with omentectomy. So we do this, we send the entire thing for histopathology, and if histopathology comes out malignancy, then based on what type and grade of malignancy, we decide further what is to be done. If she has already presented with ascites and we have tapped that ascites and we know that it is a malignancy case for sure we are dealing with from the ascitic fluid analysis,